Hello, my name is C.L Soo. I'm an orthopedic spine surgeon. Today we're going to talk about issues with sacroiliac joint dysfunction, or sacroiliitis. It's a commonly overlooked problem because this type of problem normally cannot be detected by common imaging such as MRI, CAT scan. SI joint is mainly a weight-bearing joint. Basically, we have weight go through the lumbar spine and then go across, we call it sacroiliac joint, and then go to the hip joint and then go down to the leg. The common cause of SI joint problem including previous lumbar fusion, which is common. 40% of patients have previous lumbar fusion can have SI joint problem. The other big cause is trauma, such as motor vehicle accident, or people step off the sidewalk, or step into a hole, have some kind of twist injury. The other big reason is to do with pregnancy. The complaint of SI joint problem typically is mainly located in the buttock. It can go down to the leg, such as feels like sciatica type of pain. Of course, can associate with weakness. Sitting actually is probably the most uncomfortable position, and people actually bear full weight can cause the patient great discomfort, so they limp on that side that's involved. The prevalence of SI joint problem is actually quite large. 15 to 20%, in my experience, probably more toward 20% of people have chronic lower back pain with pain go down to the leg, actually have SI joint problem. The physical exam will involve lumbar spine, SI joint problem, and the hip joint. Right now, we look at all these three as one region of a problem. For SI joint exam, is very specific. We go through a certain specific maneuver to find out if the patient has SI joint problem. If the patient is positive on sacroiliac joint examination, I typically would start treatment with physical therapy, and we'll start with we call it a therapeutic block of SI joint. If the physical therapy does not help much, and the block typically helps for a short time, then the next step we do what we so-called a diagnostic block. The diagnostic block of SI joint is very important and very specific because we don't really have an imaging to diagnose this problem. As long as in that 1 hour, 2 hours, the relief is more than 75%, that helps us to identify this SI joint problem. After we identify the SI joint problem with SI joint diagnostic block, we will recommend typically a surgery in Oklahoma Pain and Spine solution. We do a minimal invasive type of surgery. It takes about an hour. Patient go home the same day. After the surgery, we typically ask the patient not to put a full weight on it for a total of 6 weeks. After that, and patient can start doing whatever they want. The device I use typically is a triangular implant it's called iFuse. The reason I use this rod is because it has the most data and it is the most credible information. If you have a back pain, leg pain, groin pain, and you think it's from SI joint problem, we'd be very happy to see you in my office in Oklahoma City.